Hi everyone, it's Dr. Russ, and today we have Bethany. And about a month ago, Bethany was moving and had been moving and gotten fatigued and was kind of like into the process and lifted wrong. And since then, there has been pain in the lower back bilaterally around the sacrum that's worse with flexion. And then over the last week or so, just starting to get some pain in the left hip around the iliac crest down the IT band. So we have to do a diagnosis and figure out what's wrong. Is there anything I missed?
I don't think so.
Okay. Would you stand up and turn around and show the camera where it hurts?
So like all along this whole lower kind of cradle, right in the middle and along the sides here.
Okay.
And with it kind of going up into the lower back.
So the top of her sacrum is right here, and she's really indicating most of the pain is being below that, so around the sacral area. So that makes me think of a couple things. One is sacral fascia and potentially injury to the fascia over the sacrum. Another is that it is referred pain from L5 disc or L5 joints. So I'm going to hold this together for you, and I would love if you have room for you to just bend forward a little bit until it hurts, okay? Let me know when that starts to hurt.
It's like, as soon as I start, yeah, right now, I can start feeling it here.
Okay, come on back up and lower down again. Right there, okay? So that's right where L5 starts to move on top of the sacrum. Okay, so come on up, and I want you to bend back, like do a little bit of a back bend and let me know if that hurts at all. You're really quite flexible in that dimension. How about if you let your hands go and lean to the right? Pain there?
No.
Good. And left?
It's like some stiffness, but I wouldn't call it
Yeah, I see
pain.
that. Come back to neutral, please. And lean left again. I'm trying. Hold that forward for us. Thanks. Okay, come back to neutral one more time. Okay, I've got my finger on the L5 spinous here and my finger on the sacrum here. Go ahead and tilt to the left again. And it's so stuck right there. Okay, come on back up. So the lower lumbars are not moving into left side bending. And so that indicates that something is swollen on the left side. It's not letting those vertebrae approximate on that side. And when you go to the left and you try and go to the, tilt to the left again, does that give you any of that referred pain into the hip?
No.
Nope, not at all. Okay, great. Come on back. I'm going to close this up for you. So let's do some more exam, and I'll have you lying on your back.
Okay.
So one way for us to determine whether there's any neurological entrapment or impingement further up the chain is to test sensation. And I like to test sensation with a tuning fork. This is 128 hertz tuning fork. It's pretty low frequency. And the reason we do that is when there is slight compression on a nerve, the first sensation to be affected will be vibration. So we're going to test your vibration sense. You ready?
Yeah.
Can you feel?
Yes.
Is that humming?
Yes.
Okay. There? Mm-hmm.
I can feel the pinch, but not so much the hum.
Okay, let me give it another.
Yeah, I can feel that. Yes.
Good.
Yep.
Okay, all your toes. We're going to test the ankle now. Inner. And outer.
Yep.
Okay, good. So sensation is intact. Another thing we're going to test is motor function. So the ability of the brain to communicate to the muscle. So start by pulling your toes up toward your head, Bethany. So you hold them there. I'm going to pull toward me. Good. I'm going to give a nice sustained pull. Good. That's really strong. And now curl your toes. Nope, the other way. Yeah, curl like you were. And push against me as I try to uncurl them. Good. Good. There you go. Took your body a second to find those muscles, but there it is. Now point the whole foot down and push into me. Good. That's all nice and strong. I want you to keep the knee facing the ceiling, but just turn the ankle out and push out against me here. Push hard. Push. Peroneus longus is good. And then you're going to push in. The ball of the foot into my palm. And tibialis posterior is good. So that's the L4, L5, and S1 nerves. Those are all functioning well, which is good. We like that. So the next thing I'm going to do is I'm going to lift your leg. And we're going to see if pulling that nerve against something in the lower back is going to cause pain down your leg, okay? So I'm going to lift, and you're going to tell me if and when this starts to hurt in the low back and hip. So we're about 45 here, and so far so good. So I'm going to pull the toes this way. Now we're putting a lot of tension on your sciatic nerve. Is that creating pain in the hip, the low back? Nope. Going to do a little bit more with a little internal rotation here. We're really pulling that sciatic nerve now. And we're good.
Yeah, definitely a stretch, but no pain.
Okay, good. I'm going to feel the hip now, okay? So I'm going to bring it up, out. So far, so good?
It's tight. It's tight.
Tight.
Uh-huh.
Through here.
Yeah.
Okay. And in the lower back, in the hip, in the sacral area, where do you feel the tightness?
Mostly in the hip and like, I think the front.
The front of the hip.
Okay.
I bring this around. So far, so good? Okay, great. Interesting. This is starting to look a little more like a psoas issue, which would be better than a disc issue. So let's just do a little psoas test, okay? We'll take it a little bit at a time. I want you to start by lifting this foot straight up to the ceiling. Good. Any pain in the low back or hip with that?
Minor.
A little
like
bit.
A little strain or stress, but.
Okay. So I'm going to lift your leg for you.
Okay.
Okay, we're going to put the psoas into this shortened position. I'm going to let go. Can you hold it up? If it hurts, just let it go. It'll flop back to the table, no problem. Okay, what's happening there?
No pain.
So I'm going to stabilize your right hip. I'm going to push on the left psoas here. I want you to hold if you can. If it hurts, just let go. Okay, try real hard here, okay? Push. And relax.
It does start kind of feeling sore back here.
In the lower back. Okay, good. I'm going to do the other side. Okay, we're going to lift here. Toe points out a little bit. Hold it up. Stabilize the left. I push on the right. Push real hard against me here. Good. And what happens there?
Not the same pain.
Okay, so it's like a left psoas issue. That's part of it. Okay. Why don't you lie in your tummy? Landmarks first. Left SI joint is here. Not swollen. That's not tender, is it? Okay. And the right SI joint is here. And that also feels pretty normal. Is there any tenderness here, Bethany? Okay. So coming here along the sacral fascia, that doesn't feel particularly grainy or swollen or puffy. So I don't think that's the thing. So we're getting here into the lumbar spine. There's L5, 4, 3, 2, and 1. And yeah, L5 is really stuck. So the question is, how much swelling is in there? And that's important because that tells us whether or not it's safe to do any manipulation or movement. Yeah. So as I'm getting a little more into the structures here, I can feel that L5 right there is rotated to the left. So if her whole body was L5, it would be turned like that. Yeah. And so there's this posteriority coming up the left side. That's L5, 4, and 3, all three of these. Okay, so this is looking less and less like a disc problem because the straight leg raise doesn't hurt because the motor and sensory function in the foot is totally normal. And I can just kind of tell by the way your body is reacting and feeling to this little bit of movement. If it was a disc issue, that would be really super painful and really triggering. So that's good. So, yeah, so I think you sprained something. And you're 35?
34.
34, okay.
Tis the season.
Yeah, I know. This is a hard conversation. But the thing isn't that like, oh, you're getting older and your back is going to hurt forever. That's not it at all. The conversation is things don't heal as quickly as they used to. And in particular, spinal injuries, even a mild one like this, can be surprisingly painful and take surprisingly long to heal. Yeah, like it's not unusual for a pretty basic low back strain to take 2 months to really fully heal. And it feels like that's what's going on with you. So we're gonna, with your consent, what I would like to do is continue working the muscles like this, getting the movement in through the spine, helping to restore circulation and flush out some of this little bit of swelling, and gently, not forcefully, get a little bit better position of these 3 vertebrae. Okay? Okay, good. Thank you. And then following that, to do a little work on that psoas, because it's obviously involved. And I don't know if you've ever had psoas work before.
I have.
You have, okay. So I think that will be helpful as well, either today or another day, depending on time and what you're up for. So you're doing great. I really like the breathing that you're doing. And you can feel I'm just kind of gently working through the layers here. Okay, I'm going to take a moment's break to move the camera, okay? Good. So even though it's the left side where the leg pain is, it's both sides that the low back pain is. So we're going to work both sides. Wonderful. So just from that little bit of work, it really freed up L5. Is feeling a lot more loose. L4 a little bit, L3 still stuck. So let's work a little bit more on L3. So I've got the 3rd lumbar spinous right here between my fingers, and I'm just going to give it a little bit of mobilization, very gentle, and really getting a sense that on the left side and the left L2-3 facet right there, that's where it's really stuck. How does that feel to you?
Feels really great.
Feels nice. Good.
I can tell that that's a tender point.
Yeah. Okay. I am going to use a little bit of cupping right here. Okay, so when I use cupping in these circumstances, I'm going to slide the cup back and forth over the stuck spot. Okay. So you're going to feel a suction feeling here, just of the tissue in the lower back, just like that. So it's a silicone cup that creates some suction, and then when I release the suction, it lifts the skin and the outer layers of tissue like this. Okay, so I'm tractioning it toward the ceiling, and so we're literally opening up capillaries and lymphatic channels and veins in order to make space for better circulation. And now with my hand, I'm going to kind of traction your skin down while I roll that cup over the injury and down, just like this. So it's a way to mobilize without using compression. It uses traction and a lift instead. Good. I can feel it right there. It's like a little bit of a speed bump. Mm-hmm. Good. You're doing great. Couple more deep breaths. Good. Wonderful. One more nice deep breath. Good. So as you can see, there's just a little bit of redness. This probably won't leave any purple marks like you sometimes see after cupping, because that was pretty brief. Again, in an acute injury like this, big dramatic treatments can often exacerbate the issue. It's much more about like the reason she's still acute a month later is that something in there is really stuck. There's some swelling in there, and we're not going to get you out of this acute state with dramatic movements. We're going to do it by assisting your body in breaking this cycle of pain and inflammation. So your body wants to heal this, and so We can open up some circulation, relax some muscles, restore a little bit of movement. It will hopefully get your body moving in the right direction. So we'll check in again in about a week. Good. Nice deep breath. Right there. Good. So now I don't know if you can see this on the video, or Bethany, you can feel how much just easier this movement is right now. Does that feel different to you, honestly?
It does.
Good.
It just feels like there's more wiggle.
Mm-hmm. There's more wiggle. Exactly. So there was some muscle spasm in there, some swelling, and the swelling makes the joint, swelling in a joint will make the joint like a very taut water balloon. So it has no bend. It has no give. Okay, let's do this here. Okay. So we can do some psoas work,
Okay.
or we can call it here. And if you want to stand up and walk around and kind of see how this feels. So we're going to do some psoas work, and it's always sensitive, and it's usually ticklish. So her iliacus is here. There's the ASIS right there, and nothing big or major is jumping out at me in the iliacus. And as we come a little medial, it doesn't feel swollen or torn. It doesn't feel like there's a psoas injury going on, which is a really good thing. As I come here and I'm crossing the inguinal ligament, it's naturally going to get a little more tender. And how is that right there? Right there. Bethany, is that particularly tender or sore?
Mm-mm.
No, good. Okay, so the distal psoas is intact, is not particularly problematic. Okay, looking at the top half of the psoas here, it's deep to all of the organs. So rather than just like mosh our way through the intestines, we're going to take it a little bit at a time, and we're going to kind of encourage those visceral organs to get out of the way and just kind of droop toward the floor. That's why we like to do this side lying. It gets them out of the way. So here we have her internal oblique coming up this way. Feels pretty good. And the external oblique coming down. And there's a little bit of a hitch in it right here. Tender there.
Now that you press on it.
Okay.
Yeah,
Yes. So the transverse abdominal, way deep to that. And the QL back here, kind of hooking onto the front of it here. That got a little bit of a painful reaction from you. So I'm going to just make a note of that. So as I come in a little deeper now, getting on the psoas right there. So I'm going to stand up so I can get a little better angle. Okay, I'm on the psoas here. I know it's uncomfortable. Is this painful?
Mm-mm.
Good. Couple of deep breaths. There it is. Right there. So right level with the belly button. There's a strain in the psoas right there. Does that hurt?
I mean, it's an intense feeling,
Okay.
but I don't know if I would call it pain.
Does it, as I press on it, does it create lower back pain?
No.
No, good. Okay, so it's something, but it's not the thing that's causing lower back pain. So that's good to know. Well, it's funny how it probably all fits together. You know, the psoas dysfunction is definitely causing the lumbar spine to be a little bit less happy. So now I'm off the psoas and I'm actually on the front of the QL. I'm going to get in here because I have this opportunity. I'm going to take this opportunity to feel that QL right there. How's that feeling?
Pretty good.
Good. Awesome. Good. Good. So working out that left QL, and it did just let go pretty nicely. Good. So I'm going to ask you to just lift this leg for a second and straighten it out. And I want you to lift it up to the ceiling so we get a little bit of action through that QL right there. Lift it up and down a few times. Is that painful in the low back?
No.
It's a really great movement. And the QL is contracting and relaxing really nicely. Okay. So I'm going to take this and this. And I want you to take your time and stand up and walk around. So tilt to the left for us, Bethany. Good. And you can see L5 shifting now. So come back. Sacrum, L5, and go ahead and tilt left. Good. And there's a little bit of movement relatively in between those two. That wasn't there before. And that is like the goal of a treatment here today, is to restore a little bit of movement here. Bethany was saying as she got up that it feels looser, which is great, but it still hurts for her to curl, right, or flex the lumbar spine. That's because it's still injured, right? We didn't make the injury go away. We just got some movement in there. And now that it's unstuck, as long as she's careful, and I'll give you some more specific instructions, this will start to heal. And in a week, it won't be all better, but it should be a little bit better. And we'll do some more. And then, so I would say maybe 2 more treatments after today, but we'll take it day by day because there's still some unknowns and we're still remembering that there's some radiating pain down the left leg that is going to be on our radar. We want to make sure that that doesn't get out of control. So I'm going to button this up for you. You can let that go. Thank you. So I'll see you in a week. Good? Okay, good.